Guys, welcome back to Medical Coding with Blue. Today's episode is all about some things to consider if you are thinking about pursuing a career in medical coding. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so if you are thinking about getting into the medical billing and coding career field, and you've heard quite a few things about the career and some of the more attractive reasons that people choose this career field, well, I'm here today to tell you that those things that you're hearing about, a lot of them either don't exist or they take time to earn, okay? No one gets into this field automatically getting all the things that they want or the things that they're hearing about from these school recruiters and things like that. So the other thing I will say is this: I am a 17-year medical coder. I've been in this field for 17 years. And I have been studying it for just as long, okay? I got my certification in 2008. I started studying in 2007. So that's the thing that I need you all to understand. I'm not here to sell you anything as far as a program, as far as credentials. I'm not here for any of that. I am just a medical coder that's making this channel to give people a reality check. There's a lot of misconception in this field about everything in this career field, right? And there's a lot of people that speak like they know about our career field and have no clue. There are school recruiters that are not even certified. They're talking about all of these things and how you're going to get trained on the job. And while there is some training on the job, that is more geared towards the electronic health record, because everybody uses a different electronic health record. And even if two facilities or two different doctor's offices or practices use the same electronic health record, for example, Epic, it doesn't necessarily mean that the program is going to be the exact same, because Epic is based on, you can purchase it based on different things as far as like the needs of that facility, like the more power it needs and that kind of thing, or just different specialty things in Epic. It'll be different packages for different places. So employers are willing to train you, but when it comes to those types of things and the processes of their facility, they are not willing to train you when it comes to medical coding. When you become certified, that is when they expect you to already have an understanding and a firm grasp of that. But as I said, medical coding, medical billing, health information, it is a business. It is a business at the end of the day. And so there's going to be people that are going to sell these programs and, oh yes, we can get you on the way to making this high salary in just a few months. 2-month programs, 3-month programs, 6-month programs. These are all too short to learn anything about medical coding. It doesn't matter if you've been a nurse or if you've been a doctor. It does not matter. You need time to learn medical coding. And that's one of the things that you should know. That's the first thing that you should know, is that it's going to take time. 9 months, 12 months, or 18 months is what I recommend for a good length program, because there's a lot of those fast-paced medical coding programs, and a lot of people will tell me, well, Blue, this is all I can afford. Well, I know that is not true, because I have the independent study that is listed, the syllabus, right? And the syllabus, if you don't know what that is a breakdown of all the subjects that you need to learn and know if you're going to take any of the 4 main medical coding certification exams. There's 4 that employers are looking for, and all you need is one. All you need is one. There is the gold standard of medical coding credentials, that is the CCS. If you hear anybody else say, oh, this other credential is the gold standard, no one beats the CCS, because the CCS says that you have mastered, that is the key word right there, mastered inpatient coding and outpatient coding. The person that holds this credential can go anywhere and apply anywhere, at a hospital, outpatient doctor's office, an outpatient clinic, an MRI center. They can apply anywhere, okay? And because their knowledge shows mastery, okay? The CCA is the Certified Coding Associate, and that is a credential for entry level folks, right? I had that for 13 years. And the reason that I stubbornly held on to it is because there's a lot of ignorance out there in the world about this credential. Oh, there's people that say, oh, it's an apprentice. It is not an apprentice. It is an associate, a certified coding associate. This exam has the most unique domains of all medical coding certification exams. It has the most unique domains of all of the medical coding certification exams I'm talking about right now. And it is a very difficult exam to pass. This person also can go inpatient coding or outpatient coding because their test has tested them on proficiency in both inpatient coding and outpatient coding. So with that said, this individual can go anywhere, and they can also work themselves up with a credential to a CCS later on if they want to. But it's a great place to get started. I will always advocate for the CCA because I had it, okay? And there's nothing wrong with it. It's a very good credential, okay? Then there's a CCSP. CCSP is a Certified Coding Specialist, physician-based. And this is all outpatient coding, okay? So it does not have an apprentice status on it. None of these credentials have an apprentice status on them. The apprentice is just an AAPC thing. These credentials, the first three, these are all with the American Health Information Management Association. Now again, the CCSP is all outpatient coding. You can even apply at a hospital with the CCSP because there are outpatient clinics in a hospital, okay? So again, there is a difference there, but you can apply, all right? Then there's a CPC, the CPC, and that is with AAPC. And if you have no experience at all, you will have the apprentice status attached to that for the first 2 years, right? But if you go through an approved AAPC program and you purchase another program or as part of your program, PractiCode, this is a educational product that is 600 real-world redacted records that are not multiple choice. You have to code these out yourself. It is what AAPC considers to be what a coder would do in their first year. So they will consider that as work experience with AAPC. This is not work experience if you're out there in the world saying, hey, yes, I already have a year because I did PractiCode. No, PractiCode is an educational product. The CPCA is all outpatient coding. This says that you know how to code outpatient. Again, you can apply at a hospital in the outpatient clinic with a CPC or a CPCA. People do get jobs with a CPCA. I know because I'm a professional resume writer. I never guarantee the success of my resumes, but I will say that lots of people have found jobs with a CPCA because I've redone their resume. I'm just saying. So with that said, you know, if you are thinking that this is something that you can just get into and learn on the side and just, oh, that you can just do this part-time, that's the other thing. People want to set their own schedule. They want to do this part-time. Oh, can I do this part-time? I'm working as a full-time, whatever it is, and I'm about to retire. I'm going to retire in a year, but I want to work this part-time. The reason that a lot of employers will not hire brand new coders to work part-time is because if they are hiring for a part-time position, they are hiring because they need somebody right now. A new coder is going to need time to ramp up, which means to build their skills and build on their speed with coding. And so it's going to take time. Sometimes it's 90 days. Well, sometimes an organization doesn't have 90 days and they need somebody now to do part-time coding. So that's why a lot of new people don't get part-time jobs. If you got a part-time job as a brand new coder, good for you. But that's the exception and not the rule. There's a lot of people that want to sit here and go back and forth, which I'm not going to go back and forth with anybody. Because as I've said, 17 years versus you're barely in this for a few months and you're trying to tell me, no, it doesn't work that way. It doesn't work that way. I know, and I'm trying to prevent people from pursuing this, spending all the money that they say that they spent or that they signed on the dotted line for with these loans. I'm trying to prevent them from wasting their time. If this is somebody that is telling you this is the real deal, this is not somebody that's trying to sell you anything. So what you do with the information after this is entirely up to you. If you still choose to pursue it because you're saying, no, I can learn this in less than 6 months and I'm going to be on my way to a high paying career because that's what the school told me or that's what such and such told me. well, then you get the result that you get, because a lot of times with those people, they're going to be out there in the real world floundering. Or they say, oh, well, I just select whatever the provider wanted. And that is not correct. Remember, as a medical coder, you are responsible to be able to explain the codes that you have selected. And if you say, well, my provider is the one who selected this, you were the one who processed it. It is your responsibility. And if you look at the AHIMA Standards of Ethical Coding, you will see that this applies to everybody, right? It applies to everybody. And it says there, I'm paraphrasing, of course, that we have to submit correct codes. We cannot sit idly by while incorrect codes are being pushed in. Because again, what we do as medical coders is we look at documentation, medical documentation, and we interpret what the provider documented, their diagnosis and procedures performed. We put it into codes, and these codes are used for insurance purposes, statistical purposes, and planning purposes, right? So there's a lot of things that happen, and there's a lot of patients that rely on the codes that we select and the specificity, of course, because that's their health, and that is the documentation of their health. And especially if they have conditions that are very complex, it is very important that coders are competent enough to select the correct codes, so that they don't have to, that the coding doesn't have to be one more worry that they have, because the cost of their care is going to be directly related to those codes. Now, if you just panicked just now and said, well, Blue, I'm not coming from the medical side, so I don't know anything. It is possible to build your knowledge as a coder and to be able to build your competence and things like that. It is through practice. It is through working through workbooks. It is listening to webinars on AHIMA. You know, the AHIMA website has their webinars. There's webinars all over from industry experts. So that's your responsibility, is to do your research and to listen and to read and to practice and to look at the guidelines, the ICD-10 CM coding guidelines that are free on the CMS website. You can even Google ICD-10 CM coding guidelines 2025, because we're in 2025, and you'll see the CMS document pop up. It is free to download. You don't even have to have the current year books, and you could be reading the current year coding guidelines. Okay. You can learn on older books if you want to. Just make it a couple of years older, not anything too too far back. But that's just something that is available for coders. Okay. There's plenty of resources on my channel about free resources, low-cost resources for helping medical coders to learn. So again, the excuse of, oh, it's so expensive, or I spent all this money, there's no need when there's plenty of resources out there that are free or low cost. And there's even programs. I went through the WIA. It is now the WIOA, Workforce Innovation and Opportunity Act. That was how I got my schooling paid for. So there are funds for that. And so if that's something that you are interested in, make sure that you Google it. Okay. Again, a lot of this stuff is very easily found through Google. All right. And again, if you look at the description box of my videos, you'll see that as well. Okay. All the resources that are there, and just going through the videos, you'll see. I try to be as specific on the topic as I possibly can, you know, but, I made this video in a general sense of, you know, what to consider, what to think about, because again, there's a lot of people that are, you know, wanting to get through these fast-paced medical coding programs because they think they can get through really fast, and oh, we're going to make all these high-dollar salaries. I never talk about money and specifics on my channel. Never. I never have, and I never will. To me, this sensationalizing the industry, number one. Number two, it is attracting people that are not as into it, as far as they're really just kind of focused on the money. They're not focused on building their skill. There's a lot of people that don't want to build skill. They want to make it as easy on themselves as possible, but they still want to call themselves a coder. Okay. And so that I don't think is fair. And because I love the industry so much, I do not want to be a part of people getting into this industry that don't really want to be here. There's plenty of people who got sucked into these college programs and they got their degree because they said that they were told that that was what they needed. And now they are just miserable because if they would have known that, they would have never have gone the college route because all they wanted to be was a coder. You do not need a college degree to be a medical coder. That is the wonderful thing about being a medical coder, is that you can do quite well for yourself just having a medical coding certification. You know, if you want to take it to the next level and get into leadership, and that's why you want to pursue a degree, then that is something that is different. But if you are just pursuing a degree because you think that it's going to make you more money, again, this is where you're hitting a downfall. And a lady wrote to me a few days ago and was saying, oh, I know you did this video about, making more money and that kind of thing. And no. And I said, if you really watched my videos, you would know that that's a hard and fast rule. I am very clear about that. People have gotten upset with me because I don't talk about money and specifics. It's difficult to talk about money and specifics on this channel, on any channel really, because it depends on where you are in the US. They're going to start their coders off at different salaries. And that's where I wish y'all would hear me, is that different places are going to start their coders off at different salaries. If you are thinking that you're just going to run in, they're going to roll out the red carpet for you, you're going to get this high salary when you haven't even done the hard work yet. You haven't even started learning. You haven't done any of that. You just expect all of this money, right? Because people are giving you unrealistic expectations. That's where you're wrong. You have to work up to that salary. When they say you can make up to, that does not mean that is the starting salary. If you go to the Department of Labor or the Bureau of Statistics, right, they will say what the starting salary is for a medical coder professional in your area. And so at least that way you know based on where you are, because Texas will pay differently for starting salary than New York. Florida will pay differently from California for a brand new medical coder, versus if you are in Kansas, somebody who is working in Kansas and just starting out is going to get a lot different salary than somebody working up in Montana. So there's differences in salary. That is why I do not speak about money. And if you're chasing money, you will never be satisfied. I have never chased money, and I have always been satisfied with what I have. If you chase the money, you will never be satisfied. And that is a sad career life, right, for somebody, because if you're always concerned about the money and not really enjoying what you do, but you just focused on that, how much are you missing out on? I have a wonderful career. I have a wonderful job. I have a wonderful place where I work. And since 2014, I have felt like I haven't worked, because even though I'm working, right? Because I enjoy my career. Somebody who is just focused on money, and you haven't even done your part, you haven't even started to learn or anything like that, you just demand this high salary, that's just living in la la land, okay? And I personally don't understand, but whatever floats your boat, people. But I'm just saying that if you're here on my channel, we talk about medical coding, we talk about the career field, because of the simple fact that that is what this channel is for. We don't talk about money here, okay? Because you will make money, but again, if you are focused on it, that's when it will be more elusive to you. This is a very selfless field, in the fact that we are looking out for two people, right? Two groups of people, because we are really focused on the coding, right? So the coding affects the provider that performed the service. It affects the patient as a result of all of the codes and the documentation. So if the documentation is not clear, right, that doesn't help the patient, because if something happens to that provider and they can't see the patient again, and the patient has to take that record someplace else, right? And that physician has to look at that record, and that record is terrible. Well, two people failed. The provider definitely, but the medical coder or the CDI or the physician educator, they all failed, because if there's holes in the documentation, were those holes addressed? Was the specificity talked about? Was the provider educated? And it does not matter if they get upset or if they don't want to listen. That's when you have to dig your heels in and you have to work with them so that they do listen. It is possible to get providers to listen. I know, because I've gone through the gamut. I've gone through providers who didn't want to listen to me, who ended up listening to me. There's only been a couple of providers that I was not able to reach. And in my 17-year career, that's not bad. There's always going to be those 2 or 3 or that handful that are not going to listen to you, but you have to do your best. Your efforts have to be known, right? And so that's just the other thing that you have to know about, getting into this career field, is that it is selfless, because we are looking to make sure this documentation is clear. If it's not clear, we're working with those providers. We're putting our own fears aside. We're growing as professionals so that we can educate these providers so that they can document better for these patients. These patients who could be you, it could be your family members, it could be your friends, it could be anybody that you know, and a bunch of times people that you don't know, right? But you have to care about them enough to stand up to that provider and say, we need to talk about this documentation. We need to go over some education, because we need more clarity here, right? If that is the case. So that is the other thing too. And people will write me hyperventilating, saying how shy they are. I am a shy person, believe it or not. in everyday life, you see me on the street, I am a shy person. I am not out there greeting all the people like the mayor of the city, right? I am not doing that. When I do get excited, it is about medical coding. It is about the career field. That's when you see me come out of my shell, right? But that is just me, okay? But it took time. Obviously, it took time. And again, even if you are a shy person, it doesn't stop you from growing as a person. It's just that when we want to hold on to our fears, we want to hold on to our misconceptions and our beliefs, right? That we lose out on an opportunity to get into a great career field like this, okay? And the other thing that you should know if you are considering getting into the medical coding career field is that if you want to do this because you want to work remotely, right? I get that all the time. It's probably one of the more disheartening comments that I get is, I want to do this because I want to work remotely. Either I have my kids at home, or, I have some other reason, excuse for staying at home. Here's the thing. I never recommend remote work for brand new medical coders. Absolutely not. Hard and fast rule, just like the salary talk, right? Hard and fast rule. Why? Because it sets a new coder up for failure. It is the rare coder. Like I say, there's always exceptions. The exception is not the rule. There are coders who can work independently and they're totally fine. But I will always say that they are missing out, especially if they've never had exposure to other coders. As a new medical coder, you should always have your first job in person. Don't write me telling me about your story and how you know that you would disagree with me. You can disagree with me all you want to. I'm telling you that when these employers out there are looking for coders to work remotely, of course they want them to have experience. Of course you can still apply if you want to, but I'm just telling you it's going to be an uphill battle for you to get a remote job when there are plenty of experienced people out there who are going to get the remote jobs, right? Before you. Okay. And then you're just going to be one more person in that chorus of people that is talking about how, oh, no one will hire you. Well, there's a myriad of reasons why people won't hire you. But again, if you don't have experience coding it at a place where you're around other coders and this is your first time out of the gate, the electronic health record is not going to be the same as the book. It is not going to be the same as the book. It is going to look different. Providers are not going to give you all the detail all the time. There's going to be times when you may have to query them, right? Because you need to have clarification on something, right? It just depends. It depends on how educated those providers are when it comes to documentation. But it happens, all right? And so that's the thing that you guys have to understand is that if you're able to get exposure to other coders, that's going to help you to learn, right? Because there's things that you're not going to learn in the school that you'll learn in the real world. And being around other coders is going to help you with that, okay? And so then when you get experience, even if it's just 3 months working next to somebody that's a coder and they can help you with your questions and that kind of thing, that's going to be a heck of a lot better than the person that is just trying to start right out of the gate working from home. And if you say, well, I want to do this because I want to raise my kids and stay at home, they are not paying you to raise your kids and stay at home. They are paying you to do the job. And when you work at home remotely, you have to treat it like you're going to the office, because they do have ways of monitoring what you're doing and how fast you're working, your productivity. And if you say, well, how do they do that? Those IT people, they can, every time you enter in an electronic health record, you put in the number or you click on the record or whatever, you get into that record. There's a clock that starts and it's timing you. How long did you spend in this record? It will timestamp every single record that you touch. If you go into a different page, it's going to timestamp that record. Then it's going to be like, okay, she spent 15 minutes on this page and there was nothing on the page. Then what were you doing on that page? Because after a while, they will do those audits to see. And if you think that it's so easy, oh, I'm going to go run out real quick, willy-nilly, and to go do an errand and come right back, and I'm going to go drop off my kids, I'm going to go make my kids some breakfast, I'm going to do all of these things. Well, guess what? All of those things are monitored. All of those things are monitored. And for those people really living in La La Land, because they say that they want to do remote coding because they want to be able to travel, first of all, you need to be in a secure space so that no one can see your record. The record that you have up on your screen. If you think that you're going to be able to just drive around in a Winnebago and be able to go here and go there, do you think all those places are going to have internet? Just saying, okay? Not only the internet, but now we don't have a secure internet connection because you're supposed to be plugged in. Okay, you are supposed to be plugged in when you are connecting to the internet. You cannot just be connected to the Wi-Fi all willy-nilly, right? And so I'm telling you, because I have worked remotely and I know the rules. For those of you who say, oh no, my friend does this, my friend does, okay, your friend again, whatever. But there was a lady, she went all the way to Mexico, didn't want to put in for her leave, went all the way to Mexico, connected to the hotel's Wi-Fi all willy-nilly, and within a couple of minutes she had the IT folks calling her and asking her where she was, and she said, oh, she's at home coding. And they said, no, we see the computer is plugged in and into this hotel Wi-Fi all, at this hotel resort in Mexico. We need you to turn off this computer and bring us our computer back. You need to power down out of that record. And so she got fired after that. Well, it serves you right. You're not supposed to be traveling around with these laptops and with these computers, okay? Because again, if something happens to these laptops, yes, while they do have protections in place, guess what also happens? The potential for those that information to be out there all willy-nilly. Private health records. That's a potential, right? Depending. And people can get into these computers all the time. So do you really want to have a HIPAA violation on top of all of that too? Because you lost a computer, because you left your computer open and somebody could see? HIPAA violation, HIPAA violation, HIPAA violation, So that's the thing, guys. It's not all these dreamy things like you think it is. It is hard work. It is dedication. It is learning. We have to know what doctors know while never having gone to medical school. And I say this not to scare people. I just want them to be prepared. This is what you're coming into. And for me, when I realized that, oh, okay, well, I'm going to have to catch up. I'm going to have to catch up with these providers. Do I know all the things that they know? Heck no. But I know a heck of a lot more than when I started. And when I finally realized that, when I finally said, okay, you know what? I'm going to learn. I'm going to pick this up. I'm going to get better at it. And that's exactly what I did. I've gained the respect of my providers because of it. And because I have all of this knowledge, a lot of them still come to me with questions, even after they've left. Which that is the biggest compliment you can get as a coder, is if you have a provider that comes back to you for help with a question, or can you confirm what does this guideline mean, Blue? That's always nice. But I'm just saying. So it's hard work. If you're willing to do that, that's great. If you're willing to spend the time to learn, absolutely. You do not have to spend thousands of dollars trying to learn this when there's a whole syllabus, even in the description box of this video, of the books and everything else that will help you to learn, right? That you can learn from older books. And I've said that in the other videos. You can learn from older books. But when it comes to your test, you're going to need the current manuals, you know, whatever manuals, the year manuals that you need. You got to make sure that you get those. But yes, those are some things to think about if you're wanting to get into this career field. Don't do it for the money. Don't do it because you think you can travel and do all of these things, and don't do it because you immediately want to work at home. You need to be able to give something of yourself to the industry, and as far as going and getting a training someplace, right? Like training as far as like being with other people, not hold my hand and train me, but being with other people. I'm just saying. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.